Well, hello everybody, and welcome back again to our peer review, weekly peer review. Today we've got an interesting subject again, one that I believe again is an important subject. Not often talked about, I think, enough, and that is why do some people report having bad experiences with EMDR psychotherapy? Why is that? And so what I've done is I've tried to take a review of the literature and spend some time really taking a look at a lot of personal blogs of people who are experiencing EMDR psychotherapy, and tried to really kind of categorize the type of bad experiences that people can report or have reported. People have also reported a lot of remarkable understanding, actually, and a good advice. I've seen a lot of good advice of actually clients providing to other clients on how to address and approach EMDR psychotherapy, and explain a little bit about what experiences are. So I thought it might be a good idea, really from a therapist perspective, to put together really some of this and maybe talk about what are some of the suggestions that educated consumers might consider when considering an EMDR psychotherapy involvement. Basically, the type of complaints seem to fall into the following categories that I can see. What is called generally side effects. It's not really, they're not really specified, but they say side effects. The other is intrusive memories and somatic experiences coming up between sessions. It can be disturbing. Worsening anxiety and panic attacks. And the other one is increase in dissociative symptoms. And again, I'm going to talk only a little bit about what is structural dissociation in this talk, because that's really another whole talk. And we will talk about that in our future peer review weekly meetings, but not in this talk. But so to understand why I believe people have report these having these bad experiences, I think we have to go back to the adaptive information processing model to understand what's actually probably happening. And in that adaptive information processing model we've talked about in previous talks, the idea is that the brain stores information, and the nervous system stores information, traumatic information, which is traumatic memory, whether that's the actual visual imagery, sensations, thoughts, whatever feelings that are tied to the memories, dysfunctionally in the brain and nervous system. And it becomes congested, if you will, blocked up. All psychotherapy, including EMDR psychotherapy, stirs that up. All of it does. Just talking about it narratively stirs that up. So if a client is unprepared for that, and simply is thrown into talking about it, they're going to have the very same type of experiences that are reported as, quote, negative EMDR experiences. That's going to happen. Just suddenly talking about it. Okay? So again, as I was saying, in terms of the adaptive information processing model, any psychotherapy without adequate preparation with significant trauma, particularly complex trauma, is going to bring up every type of description that we have right here. Just talking about it. Okay? So that is, a general understanding, okay, of trauma. When you approach it too quickly without adequate preparation, the disturbance, the person will become disturbed. Okay? So I think, I'd like to make some suggestions about approaching any trauma-related therapy, but specifically EMDR, because EMDR is a powerful psychotherapy that gets quickly into the material, maybe even quicker than, significantly than narrative-oriented therapy alone. So EMDR, this requires a special sensitivity to the concerns of anybody who's had a trauma or traumatic, post-traumatic or traumatic experience and comes into therapy. The idea of assessment of the timing and the appropriateness of processing with EMDR or any kind of therapy, including narrative talking therapy, the appropriateness of the timing, assessing when do you start to really talk about the memory. And jumping right in there immediately and talking about it, not a good idea. Absolutely not. The timing of it. Okay? how it's broken up, how it's chunked up, whether you start from the present and go past, whether you go from the past and come present, whether you go to a specific memory. That has to really be assessed for really carefully across the board with any kind of post-traumatic experience. The other is assessment of client's ability to remain present, and we talked about this in other talks, and this is a really important concept. The metaphor, one foot in the present, one foot in the past. The ability to stay present in terms of your overall sensory time orientation, one foot in the present, and be able to observe the memory, look back at the memory and not relive it, not start reliving it, losing time orientation and starting to relive the memory. If you can't do that, you're not ready to be processing any traumatic memory with any psychotherapeutic method, and especially with EMDR. You're not ready for that. So again, assessing that ability. Can I look at the memory of what happened to me and stay fully or mostly present here in this room? And can I sort of look at the memory and come back to the present? And can the client do that on their own without the therapist present? Start with that. Can they do it on their own? If you can look at what happened to you and stay present and not start reliving it, you're probably a pretty good candidate for EMDR psychotherapy. Assessment of the client's ability to down-regulate, calm themselves down independently when looking at a disturbing memory. I look at the memory, it's disturbing, I can by myself calm myself down. Assessment of that ability to do that. That's real important. In any trauma psychotherapy, but specifically with EMDR. Adequate trust in the therapeutic relationship, which involves adequate psychoeducation about both EMDR and trauma-informed care foundations and concepts in general. And assessment of the client's external resources and supports. And that goes the same for any type of trauma psychotherapy. I don't care what it is, EMDR or otherwise. And I'll repeat that. The trust in the relationship and the chemistry of that relationship. Adequate psychoeducation, which is what we're doing, in these types of talks, obviously, psychoeducation. Both about EMDR in specific and trauma in general. Having that information base fully understood and digested so that their ability to understand the process and what trauma is and be able to strengthen their own executive functioning, as we call it, the ability to observe, make information, decision making, and the ability to stay present with information as a strengthening factor. So the person knows what's going on. They really understand the process. And so when they start processing experiences that are related to trauma, they know what's happening, and that helps them stay present. So that's very important to have that. And again, the idea of having, sufficient external resources and supports. You don't start processing trauma and then expect someone to go work an 8-hour shift in a highly complicated job, or be, say, for example, the family knows they're going to be in a crisis for the next 4 weeks. Not a good time to be doing trauma processing. Assessing that makes good sense. So, those are, I think, pretty basic concepts in assessing a client's readiness for EMDR and what the client needs to be able to ask themselves and what a good therapeutic relationship would be looking for. Okay. I think really clients need to be able to be educated consumers in dealing with any kind of trauma care, any kind of psychotherapy, any kind of medical care. They need to be educated consumers. And part of that, I think, in terms of EMDR is the ability and the need to be able to have some kind of ability to interview their providers, interview their therapists, and have a structured way of asking questions, which would allow them to know whether or not that provider has sufficient education and training to treat traumatic conditions, including complex traumatic conditions. And I think we need to assume that in terms of mental health therapy that a therapist should at least be master's degree educated. We consider that a standard in the United States. In a relevant mental health field, we consider that a standard. That they are at least basically trained or preferably certified in EMDR Psychotherapy under EMDRIA. And we can look that up. In the website, there's a link there to EMDRIA to find a qualified and or certified therapist. Basically, if you're, if your therapist is basically trained, they are not certified. And that can be a confusing issue for a lot of people, including therapists, because sometimes basic training has a certification statement that says certified in basic training. Basic training is not certified in EMDR psychotherapy. Certification requires extensive, considerable continuing consultation and then actually having your work reviewed by a qualified and certified individual before you're then certified by EMDRIA. And we expect that person to be able to deal with complex trauma if they're certified. When you're dealing with basic training, EMDR psychotherapy, some of our trainers have used the metaphor, all right, you now know how to drive the car, go out and drive the car around the block. But that's basic training. That doesn't mean that you're going to be able to deal with complex issues. And that requires continuing training. When were they trained in EMDR? Oh, I was EMDR trained 25 years ago. Well, EMDR 25 years ago and EMDR today are not the same thing. They just simply are not the same thing. And a therapist who is trained and not retrained, even 7 years ago, there are significant changes in the resourcing and assessment phases of EMDR and in dealing with complex trauma that training today has that did not have even 7+ years ago. So if a therapist was trained 10 years ago, I'd be really asking a lot of questions about that type of thing. When were they trained, and why they haven't considered retraining? Why not? Because it's often made available at a lower rate, significantly lower rate. I know here in Greenville we've made it available at an outrageously subsidized rate here in Hawaii to retrain, and we encourage retraining of EMDR psychotherapists who are basically trained. Again, as EMDR has evolved, greater resourcing methods have developed over the years, creating less negative reactiveness in client report and more exacting preparation, timing, assessment, and readiness for memory processing. The actual training itself has gotten much better at training that. I'd ask the therapist that I'm interviewing, have they procured additional training and assessment of treatment of complex trauma, or what we call dissociative sequelae? This isn't really the place for a talk on what is structural dissociation phenomenon, but basically, put in simple terms, the ability to stay present and not relive, and or handle a material that has been put outside of awareness, that the psyche is protecting the everyday functioning from. Highly disturbing experiences which we have automatically, our system, through a protective mechanism, is put outside of our awareness and kept outside of our awareness so we can function every day. And that requires specialized training in order to treat that. That's different than EMDR. And people with complex trauma have dissociative experience. Even people with simple trauma can have structurally dissociated material. When we daydream, we're having some dissociation. Okay, doesn't mean that it's pathological. That's very important in terms of complex trauma. Do they engage in regular supervision and or consultation and or peer review? How regular? Who are their consultant supervisors, and are they certified? And if not, why don't they involve themselves in some type of peer review, supervision, or regular consultation? Why is that? And I'll add to that, continuing education. Do they involve themselves in continuing education? And if so, when? And what do they focus on? What has been their last continuing education training? And if not, why not? What's that about? Why not? What is their concept of informed consent? Client informed consent. Get them to elaborate on their concept of what is informed consent. Why do I make that an issue, such a strong issue? One is I'm a social worker, so we tend to be based on that. It's a bias, and I don't think a bad one. But I think in trauma treatment in particular, informed consent is very, very important. trauma, in the traumatic experience, the client has experienced a significant violation of their own power. Their own informed consent has been taken away. Their power has been taken away. So that to treat without adequate informed consent at all phases and stages of treatment of trauma, there's the potential of recreating the same kind of coercive experience that happened to the client, which can re-traumatize. And the client will be highly, highly sensitive to that, maybe much more than clients suffering from any other type of emotional condition or mental health problem. But I personally think informed consent is the key to supporting clients' self-restoration of their own healthy functioning, of the organism's healthy self-regulating functioning. I believe it creates the necessary secure and proper environment for that. So it's an interesting question to ask a therapist, that what is their philosophy on informed consent? It's not just paperwork at the beginning of therapy. Okay, it's not just paperwork. I would ask them, do they see themselves or the client's brain and nervous system as the, quote, agent of change? Boy, that's a really big paradigm shift. And, speaking for myself as a therapist, that is a constant question that I have to ask myself in doing treatment. Am I the agent of change? Is EMDR the agent of change? Or is the client's brain and nervous system the agent of change? And I think that's an important reminder for anyone involved in any helping system, helping intervention. Who's the agent of change? There are places for the intervener to be the agent of change in human services, and those are other talks. But in this type of work, in EMDR in particular, who's the agent of change? Where's that locus of control? I think it's really having a client person-centered orientation. I think that's really what we talk about, is a client person-centered orientation. Do they see themselves as a neutral, calm person when holding space for another person? And can they sort of talk to you about that? How do they do that? How do they hold space for someone? Are they calm? Are they okay with that? Right? Clients need that reassurance. Not everybody's geared for dealing with trauma work, and that's okay. Right? It's the ability to be calm and hold space when in the midst of another person's severe disturbance. The clients need to feel secure about that. Consumers of all psychotherapy should feel free and have the right and responsibility to interview and ask and give feedback, so that the treatment is appropriate, timely, and effective, and that they maintain the client's essential role as the agent of change in their own psyches and in their own adaptive life in general. If clients find a therapist reacting to being interviewed by a consumer of their services in an unreasonable or with an unreasonable arousal, then they might want to think twice about engaging that therapist. I mean, it's okay for a client to maybe be taken aback, or a therapist to maybe take it back a little, because clients aren't usually that educated. Okay, and we come from to not that many generations ago where doctor was God. You didn't dare, question. That was really the norm. And in psychiatry, 50 years ago, you didn't dare question the psychiatrists. They had unbelievable power. So it's understandable that this is a new concept to feel that you're a consumer rather than a patient. But I think consumer orientation is necessary and should be encouraged. I think using EMDR, and the link is on the webpage, you can find the link to the webpage, using EMDR to find a qualified therapist and in interviewing at the beginning of this may be the beginning for a client and also the therapist of an amazingly unique transformational relationship, a life-changing relationship, really profound. But doing it right, I think, is really important, and making sure the chemistry is right. It's really important. It can be a life-transforming experience, not only for the client, but for the therapist as well. On behalf of the Greenwell, I want to thank everybody for coming today, and we continuing in our weekly peer review discussions, and would like to welcome you back again, and we'll look forward to seeing you.